I'd like to end with this question. You were the editor in chief of BMJ Global Health for many years, and you recently left that post last year. Um, can you tell me how your views of academic global health research and publishing has changed from where before you joined BMJ Global Health as an editor? I'm sure you had big dreams and big aspirations about what was possible. So when you left,
Something I was lucky to be thinking about before I was appointed was the role that journals play and the extent to which they should be in the business of publishing research or not. This sounds really counterintuitive because journals publish research.
all right?
Uh, but um, so when I was a medical student, I spent time at the BMJ as something called a Clegg Scholar. They still have a Clegg Scholarship program where they bring in medical students from around the world to hang out at the BMJ and see how and learn how and work on the journal. Um, uh, and at the time, the BMJ was having this interesting internal debate about whether they should become a magazine or remain a journal, right?
Hmm.
And at the time, in fact, the bulk of the printed BMJ was very magazine. The research part was past 3-4 pages out of about,
Okay.
30, 40 pages. So it had become a magazine. And I think we were trying to reconcile themselves to what it was at the time. I think it had always been a magazine kind of thing. We have to remember that when those journals at the BMJ Lancet, they were like magazines. The research infrastructure we have today was not even there.
Mm-hmm.
Even the structure of writing a research paper was rudimentary at the time. Right?
Mm-hmm.
And it became something. It became research, publication, and magazines. So anyway, so when I was appointed, I was asked. I was already asking myself before, whether journals should get out of the business of publishing research, and I still believe they should. And I hope this happens soon enough. That I don't think journals should be publishing research. I think research should be posted on preprint servers, or that kind of openly accessible online platforms, where those for whom it was done can reach them, and where this power of that gaze that journals can exert is neutered in large part. Anyway, and our journals should focus very much on ideas and discussion and debate and engagement, insofar as it helps to connect a particular community of scholars and of practitioners and of activists to one another. So I went into that role with that sense of what will be important, what needs to be important about this journal. My whole conviction about journals no longer publishing research strengthened through the years. And it began, in a sense, with me almost wishing that a journal like BMJ Global Health could serve Nigeria or Zambia or India. And even as I listed those countries, you can see how cringy and colonial it sounds, right? But we are set up to function that way, even now. There's deeply colonial. There's no reason, I can't imagine one, where a study done in India needs to be published in BMJ Global Health or Lancet Global Health or Lancet or New England Journal of Medicine. It doesn't make sense. It only makes sense in a world that is structurally colonial. That's the only world in which makes sense. Anyway, so the strength of my conviction on this point grew over time. But also the sense of fulfillment that BMJ Global Health could serve as a place where discussions and debate and ideas could be championed, especially from people who have for a very long time been marginalized in the field, when their voices and ideas could help, in fact, shape the field, what was being had. So two things were happening almost at the same time. So trying to have a journal where there was this rich, vibrant discussion and debate, which I sort of, like year 3 or so, I felt like we were getting there, and that gave us a big sense of joy. And on the side was this wish that we could serve as a platform that supported this, and the realization that we couldn't do that, or couldn't possibly do that well, and it was not the role of a journal like BMJ Global to do that, and to expect that is to expect the perpetuation of what is deeply fundamentally colonial. So that sort of grew over time. Yeah, that's how I would answer your question.
Okay, so it was like at some point probably trying to fit a square peg in a circle kind of
Yes.
thing, right? You
Yes.
realize that it was not possible. So then what do you see as the role of these journals now?
To the extent that I can describe their role, it will be aspirational, right? In other words, I don't think we currently live in a world in which the role that I wish for them was immediately realizable.
Mm-hmm.
The role that I see for them is the residual function, or subsidiary function, because I use that concept quite a bit in the book as well,
Mm-hmm. Mm-hmm.
where there are primary functions and there are subsidiary ones. Right? But I think, if you have a paper, it's worth asking the question, where does this belong primarily? Right?
Mm-hmm.
You have a research question that's been answered, an idea that you want to share. Where does this belong? In other words, which system, whether a system of academics or a system in terms of a location, ought it help connect to more of it? And then place it on a platform whose job it is to help connect that system to more of it. And that things that don't belong in those sort of situated platforms, for whatever reason, could then be taken up and served by platforms that are removed from them. And you can imagine that removing in layers of scales, right?
Mm-hmm. Mm-hmm.
So an Africa paper, belongs in an Africa journal. A vaguely defined global paper that speaks not to a particular location, but to a particular set of ideas that connect a particular set of people together, could belong in a place that is not locationally defined in that way. Right?
Mm-hmm. Mm-hmm.
And I believe, that the day will come, I may be long dead, the day will come when we will see it as unethical to violate what I've just described. In other words, unethical and strange.
Mm-hmm. Mm-hmm.
To do that, I believe that day will come, and I hope it comes before I die. So there's a rule. The same way there's a rule for WHO,
Sure. Sure.
right? But WHO cannot go and be Ministry of Health in Nigeria.
No.
And that's what the last of BMJ is global is trying to do. You see what I mean? It can't.
Sure.
It's yeah. So
So
that we
go ahead.
so we have to have a clear way of delineating
All right.
these things. As we ought to have a clear way of delineating many other things. Again, just going back. I'm sorry, I'm going back to this. To the US government new adventure in global health. An African journalist reached out to me and asked, how do you think this will affect research for health in Africa? And I said, as one says to these questions, I don't know. But to the extent that I can offer insight, I would say that we ought to be able to separate what is good and useful research from what is bad and useful research. And in my time, I've seen way too many, in fact, far more bad and useless research than good and useful ones on the continent.
Mm-hmm.
Right? In international global spaces, I'm not just talking about research that we might say, okay, little people in Africa are doing little things. I'm talking about big people in big places doing, useless and bad things.
Right.
And if USAID money for research or US money for research goes to all of those things, good and bad, then it's time for us to be able to define clearly what good and useful is.
Mm.
And there's no way of defining that without thinking about gaze, without thinking
Right.
about the service people, including where it's published and how it's published, and how it connects systems to more of themselves.
Mm.
And this may be a moment. This may be a moment. I hope it is. I'm not convinced it's going to be. Where we can be honest with ourselves. That what is good about what we do? What is useful about what we do? How can we optimize the good and the usefulness of it? Including thinking in layers as I've described, including thinking in terms of how it speaks to particular needs and audiences, and how we almost theorize the value of the work from the beginning, including from where the research question comes from, how the work is written up, where it is published, what happens after it's been published, etc.